This is Jacob Conner for the Skin Cancer Lab. So first question that was posed was, what is skin cancer? Skin cancer is an abnormal growth of skin cells, usually due to exposure to UV radiation, although they can come from a variety of other factors as well, even in areas that usually don't have a lot of UV exposure. Then it was asked, what are symptoms, causes, and risk factors? For symptoms, it does depend on the type of cancer. By the way, this is all credit to the Mayo Clinic website for breaking this down for me. So that's my citation right there. So there's basal cell carcinoma, and appearances of that can include pearly or waxy bumps, flat flesh or brown colored lesions, bleeding or scabby sores that heals and return, have a little cycle, like a perpetual wound. Squamous cell carcinoma can include firm red nodules or flat lesions with a scaly, crusty surface, kind of nasty there. And then there's the kind that many people have probably heard of, which is melanoma, which includes large brown spots with darker speckles, moles that can change color, size, feel. Basically, if you saw a mole that wasn't there the day before, you might want to get that checked. Painful, itchy lesions, or dark lesions even on unexposed areas. Causes, obviously, like I mentioned before, it's caused by a mutation in the skin cell DNA that causes uncontrollable growth, like most cancers. This can be caused and is mainly attributed to UV exposure, but often other factors like exposure to toxic substances, having a condition that weakens your immune system can also play a factor into cancer. Risk factors include, you're kind of looking at it, fair skin, history of sunburns, excessive sun exposure, sunny or high altitude climates. It is a lovely almost 90 degrees right now outside, so good day for this lab. Moles, they can be affected by that if you already have them in place. Family or personal history of skin cancer, thankful don't really have that though. Exposure to radiation or toxic substances, not on a normal day. And weakened immune system, all can play factors into that. Age is sometimes considered for that as well. The role of ultraviolet in increasing chances. UV radiation damages skin cells and can cause mutations much more commonly than sometimes they can happen. These mutations can happen on their own without any extra push, but that extra damage to skin cells can really push that damage over the edge there. And how can it be avoided? Well, stay out of the sun at its peak. The website, Mayo Clinic website, did recommend kind of staying out of the sun or avoiding it between 10 and 4 p.m. It's usually that zenith of the sun at the top there. Wear plenty of sunscreen year-round. Cloud cover doesn't help. I know it's always told that as a kid and never really listened. I got toasted a lot, unfortunately. Sunscreen year-round. Keep applying it. It does recommend every 2 hours. That seems like a lot, but they're the doctors. Wear protective clothes like long sleeves, wide brim hats, sunglasses that block UVA and UVB types. And so yeah, and then on to the results of my experiment. Results were pretty good, all things considered. Here's the control. Might be a little hard to see with the camera and the light, but it is basically white with a little bit of pale blue on there. That's with that 5 minutes of direct exposure. The 30% or the 30 SPF, more of like almost like a robin's egg, like an eggshell, almost like an eggshell blue. Definitely an improvement over that, but not as drastic as maybe I was hoping. And as you can see from my bag, actually, I picked that up. I did put a lot on there, so I mean 30 SPF is usually the smallest you can find over there. I have seen 15 before, and I think I might have shown a bottle here for that later experiment. And then for the 50 SPF, maybe a couple shades darker, but not extreme. I don't know if how much more of a difference the 50 compared to the 30 SPF. It is interesting to know. I don't know if that was just the way it was designed, but the two that were provided with this Science Interactive kit, the 30 SPF was much thicker, almost like a paste, while the 50 SPF was more creamy, which made it a little harder to spread onto the back of the experiment. But yeah, these results pretty much line up with what you'd expect with an increasing SPF compared to a blank control. and you can definitely see how that can really help protect your skin as opposed to like a blanched white versus these colors here. Thank you.